For epilepsy, there is hope. Hey podcast listeners, Tori Robinson here for Epilepsy Sparks Insights, a podcast about epilepsy, epilepsy research, common comorbidities, and all of the fascinating science behind it. Whether you have epilepsy, are a family member, a neurologist, neuropsychiatrist, therapist, neurophysiologist, scientist, or researcher, Epilepsy Sparks Insights is designed to help you learn more about epilepsy from the other side of the table. I'm a person with epilepsy and some missing brain tissue. I hope to help bridge the unnecessary gap between patients, the public, and the aforementioned. Because epilepsy research and science are cool. In the last episode, featuring Tolu Elanyan, we discussed her role as a learning disabilities nurse specialising in epilepsy and her work through Pretola Global Health Consulting, where she provides epilepsy training for clinicians and charities in low to middle income countries. This week on the programme, we are talking to Dr. Callie Seaman, who is a cannabis scientist, educator and campaigner, and is the co-founding director at Aqualabs. And do you know what? She happens to also have epilepsy. This is Dr. Callie Seaman, who is from, what city are you from again, Callie?
Sheffield. I live in a town called Worksop, but it's Sheffield I come from. It's Sheffield Hallam I studied at.
We can have people named or titled doctor in so many different subjects, and people presume you're a doctor of medicine. But tell us what you are.
So, I went on a bit of a funny kind of route. I started off by doing a degree in biomedical sciences. That was my undergraduate. Worked for GlaxoSmithKline for a year and really disliked it completely. It wasn't that my cup of tea. Went into the hydroponic industry, and that is growing plants without soil. So it's using nutrients, and we developed a company that produced the fertilizers that went into that. That's Aqualabs. So, that was originally aquaculture that I used to work for. So they were the ones who sponsored my PhD. Okay. That company went into administration, and then I started another company called Aqualabs from there, and we became a liquid nutrient manufacturer. And part of that, we went into the medicinal cannabis arena and started going into licensed cultivation facilities and helping to increase yields in there, looking at the secondary metabolite, actual ratios that are there between the terpenes, the THC and the CBD, and looking to perfect those and work with companies to help perfect those for particular diseases. Now, we all know epilepsy. Yes. There is links there.
And tell us about your relation to epilepsy. What led you down this particular road?
Well, when I was 15, I had my first grand mal. I now look back and realise that when I was younger, I was having other fits. Did you feel any before when you actually look back at that was an aura?
Oh gosh, yes. Mine was years before I was diagnosed. I was having them. Yeah. I was having focal seizures and absences, but nobody noticed for about at least 4 years.
Oh,
at least. Yeah. Sorry, carry on with your story.
So, age 15, I had my first grand mal at school. Ambulance comes down, the whole school sees that, rushed off to hospital. Then discharged very quickly, had another cluster of fits that day. And was rushed back into hospital and was very quickly put onto clozapine. Right. But I was very lucky. I had a father who was very open-minded, and really he felt that we didn't get it wasn't as well researched back. This was in 1995, so this is last century.
A lot has changed, hasn't it, since then? A huge amount has changed, yeah.
Yep. We only had two kinds of seizures back then.
Oh gosh, it was petit mal and grand mal, and that was it. It was absolutely ridiculous. And now we know, if people have been looking at our posts, there are about 60 different types of identified seizure, about 130 different rare epilepsies. And we know through research, it is gonna go through the roof. It's just gonna get bigger, right?
Yeah. Oh, one of the funniest ones I heard was someone runs. So they lose consciousness and start running.
Oh, I know somebody like that, naked.
Really?
Yeah, I've started stripping before in a seizure too.
Oh, trousers with me. Every time, if my trousers are around my ankles, I'm probably having a seizure, because it's just something I try and do. And I don't know why. Right? It's nothing to do with thinking about wetting myself, though I do wet myself when I have a grand mal. But trousers around the ankles a couple of times.
Good, darling. Yeah. And actually, do you know what it taught me after I'd done that at work? Was always wear nice undies to work. always. And, you know, just be well presented, because you just never know who's going to see what. That's all I can say.
It's that old saying, always wear clean pants in case you get run over.
It's exactly like that. Anyway, so you had this delightful anti-seizure medication then, and your dad was cool about things. What did that lead to?
He was not happy about they're not really examined myself. They were very quick to put me on these, and he introduced me to cannabis.
Sounds shifty, but continue.
Yeah, well, I suppose back then it was. But he would always make sure that I had a supply, so that I was always consuming. And my fits, for 25 years, I didn't have a grand mal. Well, there are times I know I look back and I was certainly having auras. I certainly know that if I'd passed out in the toilets, I'm not sure. I start to look back and think,
was I just being a bit weird, or was I a bit like, it's hard to tell sometimes, I think, for lots of people. And they get worried that they can't identify. It's like, am I just having a moment that loads of people would have? Or is this a milder type of epileptic seizure? It's hard, right?
Yeah. Is it an aura? Is it that feeling? Yeah. And I've recently had a friend come to me, bless her. I knew her at school, and she's had her first seizure. And the thing what I've been talking to her is, go through that time before that seizure. What were you feeling? Anything different? Was there a taste? Was there a light? Was there any, visuals? Everything. Did your hands? Because my hands would go numb. So I start to not feel my fingers. But that point, I think, is very important to really understand that and really know that time, so that you can.
Lucky enough, I guess. Because I think we are lucky, because I, like yourself, I will get an aura prior to a tonic-clonic, or even prior to a focal, actually. And I really feel for so many people out there who don't, their brain just goes, yeah, sorry, mate. And that is, yeah,
not good.
So you had your seizures controlled, well, at least the majority of them, as far as we're aware, controlled for over 20 years using cannabis.
Yes.
And so it was illegal to do so at the time, but in your mind, and I can completely understand why, I've reflected and thought, if I knew that was going to not have a negative impact upon me intellectually, emotionally, but it would have controlled my seizures, I'm thinking, well, maybe. But obviously, so this is how you got into your work today, I guess. Was it conscious or subconsciously it steered you in this direction?
Well, yeah, subconscious to start off with, and then realizing at 37, when I had that, I had the grand mal, that it was the point of smashing my face up. I broke this tooth. It happened at work, and I collapsed in a toilet. I got up, and then I just hit a sink on the way down. Big egg on the head. And that was the kind of the awakening of saying,
this is an issue, mate. You've got to address it.
Yeah. And I had a bit of epiphany. Some other things happened that year, and had an epiphany of understanding what my mission was all of a sudden.
Oh, so you're not going to get deep on us, are you? Okay, go on.
I go as deep as you want, but it was strange. I had this epiphanical moment of knowing that I had to help others. I had to help others deal with this.
Yes.
This is something that I'd actually been dealing with for many years, and had just been hiding it. And I'd come out of this denial, and I wanted to help others. And I'd been in this industry, and it was kind of, it all happened at the same time. It was kind of like some kind of force of nature caused this fit and this kind of horrendous injury to wake me up that actually, Cal, you need to be doing this. You need to be educating people. You've got a lot of knowledge on this, and you need to be sharing that.
It's exactly, very similar to what happened to me, after, oh my God, the stint in psych hospital, but after the surgery, you realize that how lucky you are to know what you already do and have the passion and ability to be able to take in what is being said from both sides. So like the side of the person with epilepsy, but those are the scientists, the neurologists and stuff like that, and kind of squish it together in a presentable way for everybody else. I feel like that's what you're doing with us now.
Cannabis is not a silver bullet, right? And that is the big thing. Everybody at the moment, there's this big buzz around it that it's a silver bullet, it's going to cure the world. It's got some fantastic properties. It does some amazing things. Work on cancer. That is mind-blowing. as actually chemotherapy. That there is a whole following of a Rick Simpson oil. I would look that up and do your own research on it and go from there, and then look up papers. There is a lot of evidence for it, but epilepsy, again, there's plenty of evidence for it. We've at the beginning of last year, well, it's about this time, we're nearly coming up to a year, we formed MedCan support group, which is for parents with children with refractory epilepsy. Now, you may have heard of Alfie Digley and Hannah Deakin. She's a big campaigner, absolutely inspirational woman. The woman blows my mind. I remember the first time I saw her spoke, and I cried, because she moved me that much. Her passion, her professionalism, you can feel the anger she's got, but at the same time, how she is going to go about this to get this changed. And we formed a group together with Matt Hughes as well, and we support other parents with children with refractory epilepsy, and them using cannabis-based products prescribed on private prescriptions that they get. And if they're wanting to try it, and some of them have obviously had to feel that they have to go to the black market because that's the only place they can afford to get it from. There's others that will use CBD oils, which are from the wellness sector. So there's a breadth of people in there, and just giving that support of other people with, other families dealing with epilepsy.
You understand where you're coming from, and understand, I'm sure people are not going to be offended by the term I use, desperation, because that's what it is. I've noticed, and I actually had a conversation with a lovely mum of a very, well, not baby, almost a toddler, little girl who had refractory epilepsy. She was still having the occasional seizure, but she'd gone down from 300 a day to about 2 a day as the result of the specific individualized mixture of different oils originating from cannabis, imported from, I think it was Netherlands, and costing her an absolute fortune, which is disgusting, and which she's not able yet to get from the UK. Has had to take a bulk order from over there, which was legal, but they don't know what the future holds.
Well, we've had a problem with Brexit at the moment. So the parents within the group, and the particular oil I believe you'll be talking about, it'll be the Bedrolite and the Bedrocan oils, and these are what is known as a full plant extract. So I like to give the analogy, if you think about this like sugar. So sugar comes from sugar beet. So you've got the beet as the whole plant. That's the whole thing. Or the sugar cane that's chopped down. That is in it, in the rawest kind of form. That is then processed into a syrup, molasses, which is got still all the compounds in there. It's got everything in. It's got warts and all, cellulose, the lot.
Okay.
And then that refines down, and then refine that further to sugar, which is sucrose on its own.
Okay.
So that sucrose is what's known as an isolate. So you get CBD, the individual compound on its own. That's an isolate. But cannabis, when it's grown, has got over 140 different cannabinoids. Now, people listening to this, they'll probably know of THC and CBD. CBD,
and that is it. That is all people know of. Yeah. Well,
there's loads more. You've got CBC, you've got CBG, you've got your THCVs. Oh, you have got hundreds, as I say, over 140 of those. You've then got terpenes, which everyone knows what terpenes are. It's the smells you get. When you open a mango up and you can smell that, that's myrcene. When you open a lemon up and that citrusy smell, that's limonene. Well, cannabis is full of those as well. And these have medicinal properties. So the one that everyone knows is lavender, that aids with sleep. Yeah. So, you've got the terpene that was within there that aids with sleep. Well, that same terpene is within cannabis as well. But you've got lots of different ones. So you've got lots of different of these smells, these aromas, these terpenes. Then you've got these cannabinoids, and they all come in different quantities. So each plant is different. Yes. And it works differently for every different person. Just like apples, and you get Granny Smith apples and you get Pink Lady apples.
Yeah, so you get basically different varieties of cannabis that provide different things. So you're not going to get all these 140 odd things from one species, one type. You're
chemovar, we call them in the scientific world.
Oh, darling, do you say that again? What was that word?
Chemovar.
Oh my goodness. Okay, guys, write that one down. Ding dong.
Strain's the common name. It's just another strain.
Oh, well, I'm not being common, darling. So continue with your long words. I love them. Go on.
So yeah, you've got different plants. So everyone knows hemp. Everyone knows about that, and that's been bred for its fibre. So it's got really good, really long stems. That's what you're interested in there, the fibrous side of it. But you've got the actual medicinal side of it, and the recreational side of bred plants with higher THC and higher CBD levels, and higher levels of these cannabinoids in there, and higher and different ratios of terpenes for different diseases, and different strains work well for different diseases. Yep. So, for example, a lot of people find CBD works brilliantly for epilepsy, so need high levels of that. But for another person, for say pain, or they're wanting to increase sleep, they need something like CBN in there, which helps with sleep. It's more sedative.
So that is actually very relatable, though, actually, to epilepsy, because it's such a common seizure trigger, not getting enough sleep, right?
Yeah, and this is one of the big things of why I will use it, is to aid sleep on a night, so that I am making sure I'm getting a good night's sleep. And I do know if I don't. I've recently acquired my own private prescription now.
Oh, wow.
That went through the whole process of that, and that was very interesting. Being within the world of, I go into cultivation facilities, and I've seen a whole breadth of produce that's there. What I saw come through was quite disappointing. It looked very dry. It looked very, it was pre-ground and things. Now, usually it will come as a flower and will be very aromatic. All these terpenes in there are part of the experience as well. Yeah. But no, the actual going through the process was very easy. The issue was the cost. It's cost me nearly £400 for the prescription and the appointments as well. And then I've got to have follow-up appointments on top of that, and then another prescription. But
if this is a formal professional prescription, then do you not get that on the NHS?
No, the NHS doesn't cover this at the moment, and this is part of what MedCan Support are also campaigning for, is access on the NHS. These children need these oils.
Well, not just children, but yes, of course, those are the people we think of initially, because especially the rare epilepsies can cause such awful number of and severity of seizures. But, adults too, like yourself.
I mean, I can understand why they wouldn't prescribe me on the NHS because of the cost of it, but there are children who do need this, and they should take that exception to be prescribing this on the NHS, because of when you see the difference in the quality of life these children have when they've got their cannabis oil. And then the issue at the moment, as you were saying with what you've obviously seen, is that a change in medication can cause problems. You'll know yourself when you change medication. There's hiccups on the road. And
it's like you see just peekaboo. Yeah.
It just goes, ah! And so changing oils can do that. And at the moment, what we've had with Brexit is the prescriptions that were initially being wrote are no longer valid because of Brexit occurring. So they won't accept them, or they won't honour them from the Netherlands. And it's very frustrating. And other oils are now being offered, which is fantastic, and it's very commendable. But these parents know that these particular oils and these ratios work, and there needs to be more transparency about this full plant extract, about all of them, so that we know what cannabinoids are in there, what ratio they're at, and what terpenes are in there. It needs to be more transparent. This is not a simple medication.
I do find myself a bit concerned with a lot of people I come across who say, do you know what, I'm either use this as an excuse to smoke a spliff, or, and a lot of them, or they'll go to Holland and Barrett and just get whatever they want off because they've got that unregulated, I believe, what do you call it? But you can basically buy a bottle of CBD tablets or something off the shelf. We don't know how much CBD is on them. We don't know the proportions. I do wonder how much maybe placebo effect, if that positively impacts people, things we don't know, right? So unless things are more transparent and effectively regulated, only then can we, I think, give people or provide people with the most effective treatment.
We need to have options for everyone. And those who, you know, it needs that transparency is the big thing. It is definitely, and the need for lab analysis and knowing what you're getting. At the moment, there's regulations starting to be put into place for the CBD market, but that's really focusing on these what is known as isolate, and full plant extracts are kind of being pushed aside now. There is a big difference, and there's been many studies to show that there's actually a difference between isolate, and you're needing 10 times the amount of isolate CBD in comparison to full plant extract. Canada's decades ahead of us. Absolutely decades. Israel, again, there is hard data there. There's hard research, which for some reason the UK medical profession or the government or, you know, are just going, no, doesn't count this. There isn't enough research.
What would you suggest to people who are listening to this now? Because it's quite a frustrating thing to hear, right? Yeah. What would you suggest?
Awareness, is it? Right. One of the other issues.
Yeah, but also to people who are desperate, either for themselves or for their child or family member. And we're hearing there is evidence to show, empirical evidence to show, that derivatives of the cannabis plant can positively impact the lives of people with epilepsy and uncontrolled seizures, but you can't access it. So what are we saying to these people?
I would recommend you go to your doctor and take papers with you. Take scientific journals that talk about your condition and CBD and THC and cannabis as a whole. Take 5 papers with you, and you can search it on Google Scholar. If you put epilepsy in, cannabis, epilepsy and CBD, any of those, put that into Google Scholar and you will come up with hundreds of papers, right? And pull some of them out, take them to your doctor and ask them to explain them. And I've found this to be positive. The more times doctors get asked with evidence, force them to teach themselves about it. It will force them to go get the education. And the more doctors who see the actual positive benefits of this, the more chance we've got of getting things changed. That is what I would advise to everyone to do. I would look at these private clinics. They are expensive, and if it's a route you want to go down, but don't come off of any of your medication. Don't decide to stop taking anything you've already. Always talk to your doctor before, you know, reducing down any medication. That is
not a good idea. Many years ago, I'm just so fed up with this medication. It doesn't work. F it. Not a good idea.
No, don't be doing that. Do some research. There's plenty of research out there.
From different sources, I think, as well, isn't it? Because even within, in scientific papers, it can be, I think with practice, easy to identify some sort of bias. So it's really good to compare those papers. And if you're not sure, take a variety, as you were saying, to your GP, and they have ethical and I think legal responsibility to accept the information you're providing them with and consider it. And I would also say that to manage expectation, don't necessarily expect it just like that.
Yes, that, you really summed it up there. Managing expectation. This is not a complete silver bullet. It's one tool, and there's lots of parents. I'm lucky enough, I don't need to take AEDs, but I have to do a lot of lifestyle changes. I have to be in bed by 10 o'clock, watching what I'm eating, and I have to manage all of that. But I manage it as well, as I say, with cannabis. That is my medication.
And you're not on stereotypical anti-seizure medications as a result, correct?
Yes.
I totally agree with lifestyle. Since I have been getting the sleep that I need, trying to chill out, don't get me wrong, stress is in life, especially these days, but I'm just chilling, and I haven't had a tonic clonic in about 3 years now because of that. Not because, there've been other little rude word seizures around, but not the tonic clonic. So that just shows the impact that lifestyle change has, right?
Massive. Yeah. No, I couldn't agree more. It's good to hear that, 3 years is brilliant. And it's such a, yes, 3 years.
Isn't it? I never thought that would happen, so, and yeah, you think, if surgery doesn't, work, it worked, but it didn't stop them, then nothing is going to, well, do you know what? Get enough sleep, chill out. And these things don't happen overnight. A bit like, even if a person uses cannabis derivatives, they needn't expect differences overnight, I presume.
Yeah. Look, for some people it does. This is very, very specific to the person as well. We've got in us the endocannabinoid system, which isn't actually taught at in medical school for some bizarre reason. But again, you can look it up, the endocannabinoid system, and it's kind of the communication between the central nervous system and your endocrine system. So it's the communication between those two. So it's quite a complex kind of system, but it's what calms us down after we've had a lot of stress in our lives. It's what causes the levels to drop back down. To kind of sum it up very quickly, it's a very layman's term, a way of putting it, when it's a lot deeper, but the doctors aren't taught about this, so how can they prescribe something which targets this if they've never even heard of it? So that's another thing to do, is get yourself read up on the endocannabinoid system and ask your doctor about it. The more we ask them, the more they're going to be forced to educate themselves.
And totally. And I would also add, this can be quite hard to do, especially when you are desperate, is try to remain calm and not aggressive with them, because they are humans too, and they will go up, and it's like, see you later, mate. So, I really feel the desperation. I really do. But I think if you go in with these papers and almost expect them to kind of turn you away, so you might, and then, okay, do it again and ask for a referral to somebody else who might take it seriously. And you might have to do that again, but it's just, it's not personal, just do it. And that's what I've learned as a patient. Like, okay, you're not happy, you pay taxes, right, in national insurance, so ask for a referral. And there's actually a chap, neurologist, neuroscientist, Rhys Thomas, and he even said in an interview, the call we did last year, if you don't like your neurologist, don't get on, fine, ask for a referral to somebody else. I said, I won't be offended. So just do that and just remain as calm as possible. And also, I think what's really important is for mums and dads, carers, anybody who loves or cares for somebody affected by epilepsy, especially those with refractory seizures, is to value your own health as well. And make it very clear that the controlling of the person's seizures, the person that you love, is going to be of benefit not only to that individual, but to you, to your family, whatever. And I think this is a really important argument. We could go on forever, but why treatment for epilepsy is crucial. Prevention, management, because again, it's not just you and I with the epilepsy, it's the people that care for you that are so negatively impacted. And so I would write all this stuff down. That's what I do whenever I go to an appointment. Everything down, like you said, the papers, bring them along. It can't evidence. They can't turn it away. So
that's the key. That is the key.
If people want to get hold of you, how do they do so? If they want to look up your lab, if they want to find out more information, how should they do it? So,
we're going to be launching the website soon. That's coming.
What will your URL be? Tell us.
It'll be Dr. Callie Seaman .com.
Put that on your favourites, everybody.
But at the moment, we've got probably the best place is Instagram, or I don't tweet a lot. I can't get into Twitter here. Contact me on LinkedIn again. Look up Dr. Callie Seaman. If you just put Dr. Callie,
the hair's different in your photo.
Yeah, I've got to get them all consistent at some point. Sometimes it's short, but it was red, and now we've gone more auburn.
Oh, there you go. You're brave.
Oh, and look up Aqualabs as well. That's the company website. So if you're interested in the work that I'm doing, there'll be some stuff on there. But as I say, my website will be coming soon, which will be lots and lots of different things. So there'll be about epilepsy. There'll be about growing cannabis. There'll be all sorts of on there. Going through everything. It's going to be exciting.
I'm excited. And you're making me think, and I'd be interested in viewers' thoughts on this, about because we have a page on Epilepsy Sparks, which is about research. So we've got labs and stuff. Maybe we should have a little bit just for cannabis research, because it's such a huge topic. What do you think?
I think it's a fabulous idea. And I think it's a bit balanced research. So it's to be it's to be balanced, to be from all sides of, as I say, getting those experiences. There's plenty of papers out there. There's lots, there's hundreds, in fact, thousands.
That's what science is. It's looking at the whole spectrum and accumulating that information to make decisions upon, rather than being so biased and afraid of what you don't know. Because there's a bit of hypocrisy going on, I think, within the sphere of epilepsy, shall I say, but I'll leave it there. Today, I thank Dr. Callie Seaman for her time and for sharing with us factual information about the cool research she is leading into cannabis as a medical treatment. For more information about Callie and her exciting research, you can find links in the description below. Follow me on Twitter, LinkedIn or Facebook, and we'd love to hear from you if you have any thoughts about today's show. Do subscribe to our podcast and know that we are always trying to improve what we are doing here for the programme. I'm Tori Robinson. Thanks for listening.